So there's another main feature, or you could say characteristics, of primary pulmonary tuberculosis. All right, and this is what is known as the Ghon's complex. All right, so this Ghon's complex is a feature of primary pulmonary tuberculosis. All right, one of the main feature of what primary pulmonary tuberculosis before you even talk about those caseations. So we are here to look at the picture of what the Ghon's complex will look like. Then from there, we'll basically go to talk about the constitution, like composition, sorry. All right. Then we'll talk about the presentations. I'll talk about the diagnosis. Okay. So we said that a Ghon's complex is a pathological finding which is associated with what? Primary tuberculosis infection. So you could say it's like an inflammation here, and that's what we call a Ghon complex. Okay. So this is the composition of a Ghon's complex, which will be coming back to it. All right. So it consists of a Ghon's focus, and this one is a small area of inflammation in the lung, usually in the middle or the lower lobe, where the tuberculosis bacteria first entered the body. Right. So this area right now is like the Ghon's focus. That's where the microbacteria first entered the lungs. Okay. Then lymphangitis. This one, there's inflammation of lymphatic vessels connecting the Ghon's focus to the hilar lymph nodes. All right. Then, if it is connected to the hilar lymph nodes now, it will now cause inflammation of the hilar lymph nodes. All right. That's hilar lymphadenitis. That's enlargement and inflammation of the hilar lymph nodes, which are located near the root of the lungs. Okay. So Ghon's complex is typically seen in children and adults with primary tuberculosis infection. It may be asymptomatic, or it may present with symptoms like what? Cough, fever, chest pains, weight loss. Okay, may be associated with those symptoms. Diagnosis is usually made through what? If you want to know that Ghon's complex exists, you might want to do a chest X-ray or CT scan. All right, and this will show a characteristic Ghon's complex pattern. Okay, you might want to do a tuberculin skin test or interferon gamma release assay to confirm that this is actually what? A tuberculosis infection. Then you might also want to do a sputum smear or culture test to actually dictate what? The Mycobacterium tuberculosis bacteria. Okay, so treatment will involve just antibiotics using isoniazid and rifampicin for over 6 to 9 months. Ghon's complex can heal with treatment or may leave behind a calcified scar. Okay, so guys, that's it about the Ghon's complex, which is a feature of primary pulmonary tuberculosis. See you guys pretty soon.